Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's look into the neurochemical changes, and this is in case of the sleep-wake cycle. So the first one is the brainstem nuclei, which is involved in the reticular activating system. So there are two pathways. One is the increase in the norepinephrine and the serotonin. So let's look at what happens in the increase in norepinephrine and also the serotonin. Next is the increase in norepinephrine and serotonin. It causes a decrease. So there's a decrease in the acetylcholine. So after the decrease in the acetylcholine, there is presence of waking. So upon waking, there is an increase in activation of the thalamus and the cortex. So there is an activation of the thalamus and the cortex. So increase in norepinephrine and serotonin causes decrease in acetylcholine. It causes waking and it causes increase in the activation of the thalamus and the cortex. Next, we move on to the norepinephrine. So when you look at the decrease, so there is a decrease in the norepinephrine. So there is a decrease in norepinephrine and the serotonin. So decrease in norepinephrine and serotonin, it causes an increase in acetylcholine. So there is increase in the acetylcholine. So decrease in norepinephrine and serotonin causes increase in acetylcholine, and this increase in acetylcholine causes the REM sleep. So decrease in norepinephrine serotonin ultimately leads to the REM sleep. Now moving back, going on to the other side, that is in case of the hypothalamus with the circadian and the hemostatic centers. So with the circadian and the homeostatic centers. So in this case, what happens is there can be a decrease in GABA or increase in GABA. So where there is a decrease in GABA, there is GABA and the histamine, they are inversely proportional. That is, in case of a decrease in GABA, there is an increase in the histamine. So decrease in GABA causes increase in histamine, and this leads to the increase in activation and the increase in activation of the thalamus and the cortex. So activation of thalamus and the cortex, and this ultimately it is present. And then moving on to the hypothalamus, the next category, there is an increase in the GABA. So there is increase in GABA, and increase in GABA will lead to the decrease in histamine. Decrease in the histamine. And because of the decrease in histamine, it leads to the decrease in the activation of the thalamus and the cortex. So decrease in histamine causes decrease in activation of the thalamus and the cortex. And then it leads to the NREM sleep. Then what it leads to is the NREM sleep. So this NREM sleep, it goes back to the waking and also the REM sleep, as we discussed earlier. To learn and grow daily like this, please do subscribe.